Hello and welcome to the U.S. Open Health Desk presented by Mount Sinai. I'm Mal Washington, your host, joined by Dr. Alexis Colvin, an orthopedic surgeon specializing in sports medicine at Mount Sinai. Dr. Colvin, thank you for joining us. How are you today?
Great, hot.
Hot, very hot. Are you enjoying the tennis?
Absolutely.
You know, today, if we could, we want to talk about parents. How you can be the #1 seed as a parent. In tennis tournaments, we always talk about the #1 seed and the seeded players at the tournament, but what type of things can a parent do to be that #1 seed in the life of their child?
I think the very important thing to understand, and it's probably the first thing we learn in medical school, that kids are not little adults. So there is a hard stop in terms of how much speed they can gain, how much strength they can get. So you don't want to push kids past that limit. If you do, you're going to lead them to burnout. They're going to get, frustrated. You really want to make sure that you're treating them like a child.
How important is enjoyment of the sport of tennis for your child? So it's not just tennis, tennis, tennis all the time.
That's absolutely the key. You're a parent, I'm a parent. You know, if it's not fun for a kid, they're not going to do it, no matter what it is. So I think it's really important to focus on the process as opposed to winning and the improvement along the way, because that's really going to inspire them as opposed to winning a tournament at that young of an age.
Sometimes we refer to tennis as a late specialization sport. Describe what that means.
So we have early and late specialization sports. An early specialization sport is a sport where your best performance is going to be kind of before you hit puberty. So gymnastics, ice skating, those are things that you're going to train for and dedicate a lot of time to when you're young. Tennis is your best performance. We see these guys playing much later into the 30s. It's going to be after you hit puberty. So you really need to look at your tennis career in terms of the long-term picture. So maybe your goal is not to play at the US Open, but it is probably to play a lifetime of tennis. So we really want to look at the bigger picture and long-term picture in terms of when kids start training.
When looking at that long-term picture, let's look at maybe an individual tournament. What can a parent do in between matches or maybe after a tournament? What can a parent do to support their child when they maybe have a few weeks off?
Pre-match preparation, post-match recovery, sleep, nutrition, hydration, all those things really factor into making the complete athlete, and it's not just playing.
One of the things I experienced as a player growing up, because my dad is the one who taught me how to play, is I think it's important to have time away from tennis. So yes, you're on the court and you're focused on tennis, but when you're at home, maybe it also doesn't have to be a focus on tennis, but just getting away from the sport for a while.
Yeah, I think taking a mental and a physical break, they're both very important. Even the pros, they're not playing 12 months out of the year. They have an off season, so I think you really need that break, and then you can come back refreshed.
Dr. Colvin, thank you again for your time and your expertise. Enjoy the tennis.
Thanks.
Remember to check out usopen.org for more tips from Dr. Colvin and the staff at Mount Sinai. Until next time, this has been the U.S. Open Health Desk presented by Mount Sinai.